Hello guys, how are you getting on? As you can see, I'm back in my home. Actually, this is a pretty realistic shot in my bed because this has been quite a good summary of my day. I arrived like dead yesterday after 2 trains, a bus, and not much work and so on. And I said, I need to rest. So this morning I rest quite a bit. Also, I saw yesterday, as you know, in the clinic, it was the second appointment. Well, no, the first checkup after the surgery with my surgeon and my nurse. They tell me everything is going very well. Actually, the surgeon told me that I could see my orthodontist in 2 weeks. This is insane. So that means that I have to work on my opening a lot. They told me to do exercises like putting this finger here and the other down, the other of the other hand, my thumb, and push, trying to open, and when it hurts, like to stop there, maintain, and for a few seconds, and then release it. So this is gonna keep working on the joint and so on. So yeah, this is I did it today, and now because I have 2 rubber bands on my mouth and I cannot open that much, but when I don't have them, I can open like 2 fingers. And also they told me to start eating soft food. So today I ate croquetas. I don't know if you know croquetas, but they are soft food, and they are very nice. And I can eat as well pasta, things like that. So yeah, it took me only like 3 hours to eat because it's so difficult. I mean, it's so weird. Like when you put something in your mouth, it's like your teeth are in another place. Like the size of your mouth has changed. So you have to get used to the new dimensions. The nurse explained to me as a battle inside your brain that it doesn't know where things go anymore. So he has to relearn again. So we are working on that, but it's good. And also, they share with me photos from the surgery. They are pretty creepy, some of them, and I recorded like a testimony, like for people who are gonna have this surgery as well in the clinic. I'm very shy about. I mean, I thought, it helped me to see others, so why not doing it? But it's okay, I posting it here, but I post whatever I want, but I don't know, I guess it's the same, but it's more official, like, because it's the clinic and it's institution, which is going to post a video of me talking and saying my experience. But anyway, if it can help anyone. And also my mom spoke. I don't know if they're gonna post her as well. She was so cute, to be fair. And she spoke about her experience as a mom, and how she saw the whole double surgery procedure. So, well, pretty interesting. What else? Next appointment in Barcelona is gonna be in 1 month. I already have the date, and in 2 weeks I already have the date as well with my orthodontist. I go like boom, bam, boom, everything fast. Also, what else? They told me to stop with the antibiotics thing. That to be fair, I am a little bit worried because I don't want to have an infection or whatever. But if it's been a week, so tonight this is gonna be the last night I have these antibiotics. And also they told me to stop with chlorhexidine as well. But to be fair, right now I'm just going to put a little bit of my Waterpik, like I don't know how many millimeters, like 5 but because I just prefer to be safe, and also it hurts a little bit where they removed the wisdom teeth, so I think it's gonna help a little bit. When I see my orthodontist, if I have some stains on my teeth because of chlorhexidine, he can clean it easily, so I think it's fine. Also, as you can see, I slept tonight in here in the bed. It was the first day with 2 pillows here, and down the mattress I have another pillow because I wanted to be raised, and I was very scared of the swelling getting very, very crazy, and I woke up the same as the day before. So on one side I was like disappointed. I was like, oh, I want this to get faster, but then I went for a walk in the night, like to help the swelling and so on. And when I arrived and I look at myself in the mirror, the woman on the mirror, first I was like, shit, you look terrible. Well, not terrible, but a bit. And then I said, no, beautiful, you're dealing with something and you're trying to heal as best as you can, so it's important that we are kind to ourselves as weird as it can seem, but it's true that we have to be patient, and we are not ugly, we are just healing, so it's important to take our time, and also the attitude is important, I guess. And I think I told you already many things. My pain in my ears is keeping there. Actually, the whole time I've been talking to you, it hurts. So I'm a little bit annoyed about that, and also I've been a bit irritated. I read online that melatonin can cause, as well as being very beneficial for the healing, apparently, and for the nerves to come back. Actually, I feel this pretty much. I'm starting to feel this a lot. Here, I feel everything since the first day. And here, no, I don't feel it. But apart from that, I read that if you can get a bit irritated, or like, your humor going up and down. So I think it was me today. So anyway, I will try to be patient. Also, this is the second attempt of video I do, so I don't know if I already told you that I ate 6 croquetas. I don't know if you know croquetas. It's a very soft food, but you have to chew because it's fried, and it took me forever, like 3 hours. You can feel like the metal on your mouth a little bit, and the sounds of chewing sounds a lot. I think it's because of the ear thing, that it got stretched, the canal, that you hear it like very intense, like if you're biting something very hard. I don't know, but it was like, okay. So trying to bite it, like, take it easy. Anyway, and what else? I'm always like trying to think more things. 2 silly things I'm looking forward like to happen. This is silly, but I thought about yesterday. Like, I want to put lipstick on. It can sound very weird. Not now. I'm not looking forward to it now. But since SARP, after I had SARP surgery, my gummy smile was huge. So I said, like, no, I'm not gonna put lipstick on, because it's gonna highlight more like the gums, and to, how do you say, to, I don't know, enmarcar. I try to teach you some Spanish as well, but it's gonna highlight more the fact that the gums show more. So I said, no, I'm not gonna do it or use makeup on my lips. And then it's been this surgery, and after because it gave more projection a little bit. Now it's swollen, but I think it gave more projection to my lips and symmetry, because this, my chin, I saw in the pictures they showed me yesterday as well in the clinic. They it was deviated a little bit to this side, so they put it more straight. So I think in general my smile is gonna look better. So yeah, I want to do this. It's silly. And also wearing turtlenecks, it seems silly as well, but because I had a longer face, I didn't want it to use as well like turtleneck, because I thought it had highlighted more as well, like this shape of my chin and so on. So these are two silly things, very shallow maybe, but that I'm looking forward to use now. Turtleneck and lipstick. Anyway, I think that is all for now. Tonight I will have the melatonin as well, because it's helping a lot with my sleep so much. And I will take the rubber bands now to go for dinner. It's a really pain. It's so difficult because I don't have elasticity in my mouth now, and the one screw is here and the other here and here, so it's so difficult to reach this one. So I take like half an hour. Like my life is only cleaning my mouth, eating, resting, walking, and and putting the rubber bands mostly, and replying to people who ask me how I am. No, and also I ask them because I love my people, but you know, it's very unproductive. My days. But anyway, so I am thinking that I have to remove my my rubber bands, and I was like, oh, so maybe I have liquid diet only for today, but not. I'm gonna do it because I know it's good to chew and to practice. So anyway, I leave you with all of this information. And another thing that I saw, by the way, I saw the measures of the thingy, how they push my upper jaw forward. It was apparently around 6-7 millimeters. So I think this one that was more protruded should be around 9-10 millimeters. But I will ask again when I go in my next checkup with the surgeon. Anyway, I spoke so much. I leave you now. Have a good night. Love you guys.